One of the scariest parasites that can invade your body is the pork tapeworm. So let's learn about it. Welcome to Wild But True. I'm your host, Malcolm Walker. This parasite is called Taenia solium, and the disease it causes is called cysticercosis. Neurocysticercosis is a more severe form of this disease, where the larvae migrate to the brain, causing seizures and other neurological problems. Imagine having a worm in your brain that can cause seizures and even kill you. That's how scary this parasite is. But how do you get infected? Well, the primary way is by eating undercooked pork that contains the larvae of the tapeworm. The larvae are released in the intestine, and then they travel to different organs through the blood vessels, where they form cysts. These cysts are called cysticercosis. They can be found in the muscles, the heart, the lungs, the liver, the kidney, the eye, and even the brain. The cysts can grow to be quite large, up to 1 centimeter in diameter. They can stay in the host for many years, causing problems like abdominal pain, headaches, and even mental illness. But how does someone get the tapeworm in the first place? Well, the eggs of the tapeworm are passed in the feces of an infected person. So if you have poor hygiene and you come into contact with these feces, you can become infected. Also, if you work in a slaughterhouse and you don't cook the meat properly, you can also become infected. And even if you have a pet pig that isn't properly cooked, you can get the tapeworm from it too. This is why it's important to always cook pork thoroughly. If you travel to a country where this disease is common, it's important to be extra cautious. Always wash your hands thoroughly after using the toilet and before eating. Don't eat pork unless it's been cooked well, and avoid using night soil as fertilizer for crops. This is a common practice in some countries, but it can put you at risk of getting this parasite. You can have symptoms for weeks, months, or even years before you seek medical attention. And when you finally go to see the doctor, diagnosing the disease can be tricky. It can mimic other conditions like epilepsy or schizophrenia. Even imaging techniques like MRI can be misleading, because they may not show any abnormalities in the brain. The gold standard for diagnosing neurocysticercosis is actually doing a biopsy of the brain to look for the presence of the parasite. But obviously, no one wants to have a hole drilled into their brain just to diagnose a possible tapeworm infection. So what we do is we rely on clinical suspicion and response to treatment. If someone has a history of traveling to an endemic area and they present with symptoms of the disease, we might treat them for it without even doing a biopsy. And there are 3 main drugs we use to treat this disease. The first one is praziquantel. It's the main drug we use. It works by paralyzing the worms so they can be icily expelled from the body. The second drug is corticosteroids. Use these drugs to reduce inflammation in the brain caused by the death of the worms. The third drug is anti-seizure medications. These are used to control the seizures caused by the parasite. Fortunately, this disease is still common in many parts of the world. In fact, it affects over 50,000 people each year. Most of these cases occur in Mexico, Latin America, Africa, and Asia. So if you enjoyed this video, please share it with your friends and family.